a major breakthrough for cancer patients. In fact, doctors are calling this new procedure a game changer for breast cancer patients. And Dr. Caitlin Holmes is actually the first one in Alabama to perform this procedure. Explain exactly how it works, Dr. Holmes.
Thank you. This is a revolutionary tool in the treatment of early stage breast cancer for women. Historically, when women were diagnosed with what's called DCIS, or breast cancer that's contained within the milk ducts of the breast, the pathway to treatment always involved removing their lymph nodes at the time of a mastectomy to ensure that if something was different on the final pathology found in surgery, that we still had lymph node status. But unfortunately, what we know is about 80% of the time, that was an unnecessary surgery for these women. They were having lymph nodes removed for absolutely no reason. So thanks to this new technology that's really changed the game in terms of how we perform this surgery, we are able to now spare over 80% of women lymph node surgery when they're diagnosed with DCIS.
A little bit about what that means. And obviously it's less surgery, but what does that mean in the process? Breast cancer, the process of breast cancer is stressful enough as it is. I imagine this is going to relieve at least a little bit of that stress.
Absolutely, because anytime we remove something from the body, it's not without consequences. Particularly removing lymph nodes, even when it's just a few, can lead to the lifelong risk of lymphedema or arm swelling. And additionally, what I find in almost 100% of cases is the underarm pain after a lymph node removal in a breast cancer operation is usually the biggest cause of discomfort. So by eliminating something that a patient doesn't necessarily need to have, it allows for a quicker recovery and less pain as well at the time of the operation, which when you're already going through something as devastating as breast cancer, I think every single win in an operation only helps with your progress.
I love the term win, particularly when we're talking about this fight against breast cancer. We all need a good win. You've performed
Yeah.
this already. So there you have your first patient kind of under in the books, so to speak. Talk a little bit about that progress and that process, without giving too much information, where she stands in the process and the wins that you've seen for her in particular.
Absolutely. What is so amazing about this technology is sometimes women are battling a second breast cancer diagnosis. So when we're able to spare somebody lymph nodes when they've already had a previous operation where it took maybe several lymph nodes, it really is a quality of life issue. So we were so proud here in Montgomery, here in Baptist South, to be the first team that was able to offer this to a patient. And I'm so excited to be able to continue to offer this service to the women of Central Alabama as we continue to push the envelope for the latest and greatest in breast cancer treatment.
Is this something women can ask for? Is this something that women can request if they find themselves in a
Absolutely.
situation?
Yes, this is, there's actually a hashtag with this social media kind of influence with this procedure. So women could look up hashtag save our nodes and find lots of information, videos, testimonials from patients. But additionally, if this is a patient I was seeing in the office, this is called a mag trace procedure. So it's a very safe medication that's injected while they're asleep in surgery. They don't feel it. And it's just iron, similar to like you would take in a multivitamin. So very safe, very well tolerated. And I think it's just so wonderful that we can offer that to people here.
Well, I think it's really, yeah, it is. It's wonderful that it's right here and it's available right here in Alabama to so many women. Thank you. Thank you, not just for your time, but thank you for this incredible work. Thank you for all.
Absolutely. Thanks for having me.